Some longtime residents of Eriksdale and the surrounding areas say they receive high-quality emergency care here at Crowe Memorial Hospital. That is when they can actually get into the emergency room.
My heart stopped. Yep.
15 years ago, Dale Lloyd went into cardiac arrest while on the job here at Eriksdale's hospital.
Had a phone message for the nursing staff, so I went out to the nurses' station to give it to them. And when I turned around to go back to the office, I dropped dead.
She lucked out. Local nurses saved her life.
They did what Eriksdale Hospital staff is perfect at. They brought me back to life, shipped me into Winnipeg, and I was there for a month while they fixed my heart.
Lloyd was a medical records clerk at the hospital for 35 years. She says the emergency department used to be open 24/7, but in recent times, the ER has developed a different reputation. It's closed more than it's open.
I think there are people in our community that are going to die because the services aren't there to save their lives.
Data acquired by CBC through a Freedom of Information request suggests Crowe Hospital was closed 63 times last year. Some closures just hours long, others days. In total, it amounted to 306 days of closures in 2023. The ER at Lakeshore Hospital in Ashern, 40 kilometres north, was open more, but its ER was closed 128 times, the equivalent of 91 days. The Interlake Eastern Regional Health Authority says there were at least 27 full days where both ERs were closed. That presents a grim scenario.
Stonewall's at least an hour south. So depending on what's wrong with you, you might not stand a chance.
Keith Lundale is a longtime local healthcare advocate and president of Eriksdale's Chamber of Commerce.
A lot of times, even Ashern is closed, and we at times have had no ER open on Highway 6 at all.
The 67-year-old says right now the ER is only open a few days a month. Lundale said a few years ago, a former nurse at the Eriksdale Hospital needed emergency care herself. Eriksdale was closed, so it was over to Ashern in an ambulance.
She had access care because of her health. Ambulance was called. She says, "Oh, we have to take you, can't take you to Eriksdale, we have to take you to Ashern." They got loaded up and said, "Oh, no, we can't take you to Ashern, they're closed." On the way to Stonewall, they got probably, I think, 20 miles down the road. Stonewall says, "No, we're closed now." And you know, just like it wasn't hallway medicine, it was highway medicine. And nobody deserves that.
The NDP campaigned on a promise to build a new ER here. Premier Wab Kinew said this month the goal, have shovels in the ground within 2 years. But a big problem is staffing. Dr. Jade Young has roots here. The Métis physician was born and raised in Eriksdale. She works at a local clinic, and she's been at Eriksdale's hospital and ER for 3 years. She says they used to be able to keep the emergency room open 15 days a month.
We've had a drastic decline in access to emergency care here, even during my short time working here.
In her 3 years there, Dr. Young says the hospital has gone from 4 lab technologists down to 1, and she says without one on shift, you can't run an emergency department. She says Eriksdale Hospital has also gone from the equivalent of 2.5 physicians to 1.5 physicians. She says people are getting burned out.
I do my best to transfer people out who are not going to be sorted in a timely fashion because I'm a human being that has been, working for typically 30 hours in a row with only like 2 to 3 hours of sleep.
Manitoba Health Minister Uzoma Asseguara recently met with Eriksdale residents to talk healthcare. Asseguara pointed to over $300 million in this year's budget for recruiting and retaining healthcare workers in Manitoba, focusing on changing the culture in the system to make it more appealing. They say they recognize the need to train more lab technologists, doctors, and other workers in Eriksdale who may be more likely to stay in their home community, like Dr. Young has. The Interlake Eastern Regional Health Authority says it's actively recruiting medical students. They're expecting 6 internationally trained medical graduate physicians to the region this summer. 2 have accepted jobs in Ashern. There's also an urgency to get healthcare right in this aging community of Eriksdale. 75-year-old Donna Kingsley says she sent a letter to the Regional Health Authority and Health Minister outlining a variety of concerns. She's questioned whether she should leave her home of over 40 years and move to Winnipeg just to be closer to more emergency care options.
And the emergency care in Winnipeg is already overburdened. And the other thing is, how can we encourage people to come and live in our community if they don't have health care system?
I have family members with heart conditions. I have a heart condition. I've had friends have strokes, people with cancer. Like, there's lots of care needed to be given out of our facility.
Having worked at the Eriksdale Hospital for over 3 decades, Dale Lloyd knows firsthand the hospital can continue to provide life-saving emergency care with the right supports.
I've seen lives saved, like lives that you didn't think were going to be saved. And it's urgent to get something happening back in our hospital. 2 days in 2 weeks doesn't cut it.
Bryce Hoy, CBC News, Eriksdale, Manitoba.